Whether it's high blood pressure, plaque building up in the arteries, a lot of this stuff related to heart disease is silent and acting in the body for a period of time, oftentimes before people notice. And what I'm getting at here is the person tuning in at home right now, wondering where they fall on the continuum. Obviously, going to see a cardiologist or doctor and getting the proper testing done is key. But just to get a subjective idea, what are some different symptoms somebody could look at right now to determine whether or not heart disease and some of these other conditions that fall under that umbrella are acting silently in the body?
That's the challenge is most people do not have symptoms. By the time you got symptoms, you're almost too late to the game. You're probably going to end up getting, stents or bypass surgery, or you're very high risk of having a cardiac event. So you don't want to wait till you're having crushing chest pain when you exercise, or you're so short of breath you can't walk up one flight of stairs. Those people rarely don't, you know, miss the opportunity to go to the ER or hospital and be like, hey, this isn't right. It's the person who has no symptoms who has sudden cardiac death at home that you're worried about. And I've seen this way too many times in my career, and so has probably the majority of cardiologists that might listen to this if they ever listen, is that you see somebody who looks very, very healthy on the outside. They don't smoke. They don't have high blood pressure. They're not diabetic. They don't necessarily have a strong family history. Their cholesterol is not, quote, high, and they still have a heart attack. I've seen triathletes who had heart attacks during the triathlon. So it's possible to be very, very fit and look like you have a very fit, body, but you can have significant atherosclerosis. Yeah. It's not uncommon. The people who are sometimes the most fit doing a lot of the high volume endurance exercise tend to have a lot of oxidative stress and inflammation that really ages their arteries faster. So it's the test don't guess philosophy. Just because you look healthy on the outside, you really don't know until you go looking on the inside. So you can start with simple things like, is your blood pressure normal at home? You know, if you need to get one test, not a perfect test, but a pretty good tiebreaker for most people, is a CT coronary calcium score test. If you get that test and your score is 0, whatever you're doing for yourself, for the most part, means you're low risk. You still could have soft plaque, you could still have other things that are an issue, but at least at the moment, you're not in that high risk category.
What about just looking at waist circumference? And that would tie back to insulin resistance, the metabolic health we were talking about initially. Is that a fair way for people to kind of get an idea?
For sure. But not everybody's, measuring their waist and making sure it's under, 35 centimeters for women or 40 for a man. So, the quick thing is take your hands, run them down your sides, run them down your front and back. And if you feel big bumps, you have some, visceral fat in your system. The visceral fat is the fat that's around your organs. That's the inflammatory type of fat.
What do you think about this ear lobe crease? From time to time, I'm searching around online and I see people talking about it. Any validity?
Sure. So I'll start from the feet and work up. So, a couple things, and this is only for guys, is that they have leg hair and then all of a sudden they don't have leg hair. That can be a telltale sign that they're developing peripheral arterial disease. If they start losing leg hair, sometimes it's due to the microcirculation of the hair follicles or dying off and then the hairs fall out. So unless the guy is like shaving their legs or something like that, if you see that, you start working that person out for vascular disease. If they have erectile dysfunction as a man, that's the canary in the coal mine that the blood vessels of the sexual organs aren't working well. You likely have vascular disease in your coronary arteries. You need to go looking. But the sign that you're mentioning that's known as the Frank sign. It's a diagonal earlobe crease. It's thought to be because there's a collagen issue in those individuals. And if they have that earlobe crease, there's an association with increased coronary artery disease. It is not 100%, correlation that if your earlobe crease that you're, going to have it, but it's enough that if you have one, or a lot of people in your family do, and you can correlate that, hey, grandpa had that and he had a heart attack, you probably should be getting screened for it. I look for it in every patient. I do comment on it. And it's kind of like a party trick for cardiologists walking around public that, you're at, the store and you see somebody with earlobe crease and like, hey, here's my business card. You might want to get screened.
Right. So it can be valuable, but you don't put a lot of weight in it.
Correct. There's a lot of other things I'd be more worried about.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
Atherosclerosis is a lifelong disease. It can start in utero, can start before you're born, but you typically don't present to a doctor with symptoms until you're in your 40s, 50s, or 60s. And people can live their entire life, have these plaques, and not know that they're there.